In this manuscript, we review the challenges faced by the vulnerable population with communication disorders, in particular, approximately 500 million people with disabling hearing loss living across the globe. I'm Dr. Taimur Sher, a consultant hematologist at Mayo Clinic in Florida. Today, I'll be discussing an article written by me and my colleagues, Dr. Stamper and Dr. Lundy from Audiology and Otolaryngology Department here at Mayo Clinic in Florida, titled COVID-19 and Vulnerable Population with Communication Disorder, scheduled to appear in the Perspective and Controversy section of the Mayo Clinic Proceedings in September of this year. We note that these challenges are both short-term and long-term and are expected to be dependent on the socioeconomic and geographic location of the vulnerable subject, as well as the age group. For example, children in the developing country, where most of these children with hearing loss reside, are at increased risk of trauma, physical neglect, and malnourishment. In the long run, risks include delayed social development, poor self-esteem, academic underachievement, which could result in declining literacy and compounding mental health disorders such as feelings of loneliness, anger, and depression. It is imperative for the governments and local jurisdictions to ensure that the rights and welfare of such children are preserved and they have adequate access to health, as well as food, safety, and shelter. These interventions are not only important from humane perspective, but also important in the long run from the socioeconomic viewpoint of these countries, as the rehabilitation costs in the post-pandemic time could be uniquely expensive and challenging. In the developed countries, children with hearing loss could experience educational and social delays by interruption in special education programs and access to sign language. It is important, especially with the current school year starting, that the local public health and education departments ensure adequate access to speech and language pathology assessment and intervention, and access to the technological advances in tele and video communication to ensure that they have adequate access to educational tools so that their developmental needs can be addressed and they can be at par with their normal peers. Adults living with hearing loss suffer from unique challenges as well, as many of them experience chronic medical conditions and comorbidities such as diabetes, cardiovascular diseases, dementia, and other cognitive disorders. The challenges here could include cognitive overload, misinformation, poor communication with healthcare providers, difficulty in accessing medical needs and supplies, as well as medications. This could all translate into increased risk and medication-related errors. Public health and other interventions aiming at protecting and providing access to people with these disabilities with daily living, such as specialized and restricted times at grocery stores, access and help at pharmacy with expedited consultation can go a long way to help and protect the interests of these vulnerable population. We as physicians can do a lot to help these patients and their families get used to and adjust to these challenges by educating them about the need for social connectivity, the use of tele and video communication, and as well as the unique vulnerabilities faced by these populations. This way, we can ensure emotional, social, and psychological well-being of this group. In the end, we note that perhaps these populations are at significant risk in the post-pandemic area where everybody is trying to rush to the new normalcy. By virtue of their disabilities and challenges, both children and adults with hearing loss and other communication disorders may have difficulty in getting back to the healthcare system. And in those times, they will be very much dependent on their caregivers as well as healthcare providers to be their advocates. We conclude that these challenges are significant and daunting. However, we remain optimistic that with proactive planning and advocacy and the spirit of call to duty and beneficence, we can protect and promote the rights and welfare of our vulnerable population.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.